AOS application seminar series, and this time we are featuring applications within the air quality monitoring and public health research field. So we're really excited to have Dr. Yang Liu here to present his research and work that he's doing within this area. But before I do, I thought it'd be nice to give you some friendly reminders of why we really have this seminar series. And the goal for this seminar series on the AOS application side is that we want to begin to leverage and see how we can leverage AOS data products in stakeholder applications and research. This creates a great opportunity to learn from you all. This creates a great opportunity to learn about existing data, existing gaps and data needs, and what opportunities they present for ESO, so the Earth System Observatory as a whole, and AOS. We want to continue to increase awareness and participation in AOS. So again, the seminar series presents a way that we can foster dialogue on these topics. And last but not least, we want to expand the thematic areas covered in preparation for future activities, such as an early adopter program. So without further ado, I do want you all to encourage you all to reach out to us if you do have any questions on the AOS application seminar series or any activities we are doing. So without further ado, let me introduce you to Dr. Yang Liu. One second. Okay. Dr. Yang Liu received his PhD in Environmental Science and Engineering from Harvard Graduate School of Arts and Sciences in 2004 and completed his postdoc training at Harvard Chan School of Public Health in 2008 before joining Emory University as an assistant professor. He is the Gangarosa Distinguished Professor and the chair of the Gangarosa Department of Environmental Health at the Rowland School of Public Health of Emory University. His research interests include satellite aerosol retrieval and product design, applications of satellite remote sensing and public health research, potential impacts of global climate change on public health, machine learning, and spatial statistics. Over the past 15 years, Dr. Liu has been funded by NASA, CDC, NIH, EPA, HEI, and WHO to apply various satellite data products and modeling population exposure to various environmental stressors such as air pollution, extreme heat, wildfires, UV radiation, as well as the associated adverse health outcomes. He was an ORISE faculty fellow at the National Center for Environmental Health at the U.S. Centers for Disease Control and Prevention, and co-investigator for the environmental health at the U.S. Centers for Disease Control and Prevention, and co-investigator of U.S. EPA's Southeastern Center for Air Pollution and Epidemiology. He's a science team member of the NASA EVI MAIA investigation and the Terra Miser mission, and the PI member of the NASA Health and Air Quality Applied Science team, ACAS and HACAS, and HACAS 2. It is my pleasure again to introduce Dr. Yang Liu. Dr. Liu, thank you so much for being here today. We're really excited to hear from you. So at this moment, I'll stop sharing my screen and I'll let you share your screen to start your presentation.
Thanks a lot, Andrea, for that introduction. And thanks to the AOS applications team for giving me this opportunity to share a little bit of my work and kind of past experience with the satellite applications in the non-remote sensing communities. I think, NASA doesn't launch a satellite every day. It's a great opportunity, and it also highlights the consideration and valuation of NASA leadership on applications of satellite data. So I'm very grateful to have this chance to tell you a little bit about my past experiences with this field and offer some of my thought. With the understanding that the applications team have already dedicated a lot of time, a lot of effort in coming up with the possible application areas. And again, this understanding of mine is just, some food for thought. So don't I don't want to misplace your expectations. So let me start sharing my screen. Okay. So I hope you can see my screen.
Yes, we can see it.
Okay, awesome. So here's the outline of my talk. I want to give you a brief introduction of what I do, and then link that to my experiences with introducing remote sensing data to our partners, And then I want to get a little bit more specific and offer some thoughts on the select AOS enabled applications. I think there are 20 of them. I can only cover a small proportion of that. So if I can summarize all my research in one slide, and this is going to be the slide. If you follow the the blue arrows, that's kind of the core business of my group. At the center, we are essentially a data group. We produce satellite-based data products. We build our own models to generate various exposure data sets to improve our scientific understanding of environmental risk factors and how human beings, our population and society interacts and respond to different environmental risk factors. And to do that, we have three primary sources of information. At the top of it is satellite remote sensing. But it's a key factor to our work, but it's not the only factor to our work. We also rely and investigate heavily in low-cost sensor technology and how to kind of condition low-cost sensor data to improve our understanding of air pollution and other environmental risk factors. On the right-hand side, we do a climate health impact assessment, and to do that, we depend on climate model simulations. And very often, we get the data from we sort of co-design GCM and RCM runs with our partners who have the capacity to implement these simulations. The outcome of our effort is the input of some other application areas. I listed three application areas at the bottom of the slide. So my group does health effect research. That is just another way of saying this is environmental epidemiology. Once we have our own dose response functions, where we borrow dose response functions from the literature, we can conduct health impact assessment to understand the disease burden or societal burden from being exposed to a certain environmental risk factor. And in recent years, since our capabilities of generating high resolution, high quality environmental exposure have improved quite dramatically, we start to apply this new technology in environmental justice and climate justice line of work. And of course, there are kind of this crossbreeding of different components happening in my group as well. So the satellite data sometimes are coupled with low-cost sensor data to create hybrid ground truthing schemes. And we use satellite remote sensing data to bias correct RCM simulations. And then low-cost sensor data, of course, are heavily engaged in the environmental justice and climate justice type of work. And we often directly apply calibrated GCM or RCM results in our health impact assessment. So that's just kind of the overview of the things that I have been doing in the past 14 years. In this process, I have had the honor to interact with many non-NASA partners. I'll give you a few examples here. Air quality management agencies, for example, US EPA, Georgia Department of Natural Resources, their environmental protection division is housed in this larger department. South Coast Air Quality Management District, that is like a this is one level below the California State EPA. South Coast AQMD manages multiple counties in Southern California. And public health agencies, for example, environmental public health tracking. This is a program under the CDC, funded with congressional money. American Cancer Society. These are not. This is the kind of the international leader in cancer research and cancer prevention. New York City Department of Health and Mental Hygiene. This is New York's health department that cares about that handles pretty much everything public health. Okay? And Eco Action, or environmental community action, is just a community partnership, state level community partnership that are deeply rooted in the EJ space in Georgia. And then we have some other interaction with global entities like the Lancet Countdown. This is the first and probably the only global scale climate and health surveillance system. So they all have different mandates, different expertise, and different goals, for example. So I like to provide two examples, or I mean, let's call it success stories. One in the air quality space and the other in the environmental health space. Okay. So the first example is the EPA AirNow system. This is a EPA program that started in 1997 with the idea of connecting providing a gateway for the general public and other agency partners to get access to EPA's air quality monitoring data. Back in the old days, this portal is supported by measurement from ground monitors. Okay. In the combined air quality system network, there are about, using PM 2.5 as an example, there are about 400 or 500 real-time monitors that can provide hourly, near real-time updates of air pollution levels. Okay, I'm showing you a screenshot of the interactive map of AirNow. Of course, AirNow has multiple data sets and a variety of tools catering to different stakeholders. But using this as an example, you will see the dots, color-coded dots. These are historical, in this case, PM 2.5 concentration measurements in the continental US and in Canada. AirNow actually extends worldwide through a partnership with the State Department. There are several dozen embassies running near real-time air quality monitors, and their data is also displayed through the AirNow data portal. So in addition to the points, you see contours. These contours are currently generated by a fairly, how should I say this, fairly straightforward approach, which is inverse distance weighting, right? So this is 100% dependent on the ground measurements. And the maps or the contours are interpolated to a resolution of about 5 kilometers for most of the continental US. It's actually 0.045 decimal degree. And in addition to this visualization, interactive map of historical data, AirNow also offers nowcast calculation. This is also, I say, mostly using their ground measurements. In this case, nowcast is done using the past 12 hours of ground measurements. Okay, so this is their primary interface with the outside world. Okay, and as you can see currently, there's very little remote sensing data in the operational or primary product of AirNow.
Oops, Dr. Liu, you accidentally muted yourself.
Got it. How about now?
Yep, all good.
Okay.
Thanks.
So EPA has a long history with NASA, in fact. So the initial contact was a project, a 2009 ROSES project called the AirNow Satellite Data Processor. And this project was led by a EPA investigator. And EPA dedicated significant resources and their own computing assets to try to convert MODI's AOD to PM 2.5 using a fixed a set of scaling factors over a national grid. And when the project was completed and then sort of test rolled out, EPA quickly realized that the issue that if the system is based on MODIs, you get one value per day. So all the system can do is to produce a daily average satellite-based PM 2.5 concentration. It's just simply not frequent enough, and the primary users of the AirNow system needed something more frequent. Okay, so the initial attempt, I think it's definitely good effort. It's pretty well publicized, but in the end, it didn't suit the mission, the primary mission of AirNow. And then there's a second attempt. I don't know who funded this. There's a companion site called AirNow Tech. This is geared towards more sophisticated users. It's a password-protected web portal. Access is limited to basically to air quality agencies. And from this portal, you get MODI's and GOES true color composite imagery and MODI's AOD, the raw AOD, and they are placed there as external layers that these super users can access. AirNow Tech is not public facing, right? So you have satellite data there, but they're more on the sort of the raw data side. What's going on right now is the third round of introducing satellite data into AirNow. And this one, I was part of it. This is the current HeyCast Tiger Team project in 2022, led by Pawan Gupta, who's currently at Goddard, part of the AirNet team. The goal is to integrate hourly PM estimates based on GOES 16 AOD. And the idea here is that, well, GOES 16 would be able to generate multiple measurements during daytime, and it can be more readily converted to hourly PM 2.5 and be produced or be made available to the general public in a near real-time fashion. So you see the sort of the progression of this partnership. So EPA tried very hard on getting satellite data into their system. And this is driven by their need to provide more spatially comprehensive, more spatially comprehensive, more timely air pollution information to the public and to their stakeholders. And so the current round would get one step closer to that goal. I do this. Hold on. Okay, now the second example is with public health. And this is the integration of satellite data into CDC's environmental public health tracking program. Again, this is a long-standing, pretty well-known program. Tracking started in 2002 with congressional funding. And this is the first national effort to provide the United States with standardized health, environmental, and hazard data as part of a national level's regular surveillance program. As you see from the screenshot, tracking has many areas of data, areas of tools, and a whole lot of partners. So tracking's mission is to provide information from a national network of integrated health and environmental data that drives actions to improve community health. Tracking is a funding agency itself. It sustains a 33-member state or city partner network. Okay. And tracking launched its online data portal 7 years after the initiation of the program. There's a significant buildup before tracking data was made public. Again, tracking and NASA also go way back. At the very beginning, I think even before my involvement, there was a Helix project that's also funded by the Applied Science program. I think it was like 2005, maybe, to try to introduce satellite data into the tracking portal. I led a ROSES 2008 project. The goal of that project is to develop a advanced statistical model, again, driven by MODIS AOD to estimate daily PM concentrations in the southeastern US. Back then, the technology wasn't mature enough to run, national, continental, or global estimates. It was a kind of a trial. So we select the southeastern domain, as you can see at the lower left corner of the slide. It's a 3-year project. In the end, we provided gridded and county level data to CDC. And the CDC tracking team spent a lot of time building a website, building the data ingestion tools, building a data access, kind of a gateway for people to access to download their county level data, our gridded data. So there's significant commitment from our partner at CDC. After that, again, challenges came up. We realized that the model we built had limited spatial coverage. And after the project ended, we didn't have funding or manpower to continue the development and the production of the data. So this web page and this data access gateway were eventually taken down. So you can't see this data set or this web page anymore. And in addition, CDC, in order to actually get some air quality data, they work with EPA, and EPA has been providing a fused measurement plus CMAX simulation data set with full national coverage to CDC tracking. It's not perfect. The EPA national data has a 3-year lag. The most recent national scale PM concentration maps are 3 years old. The most recent year is 2019. So then we made a second attempt. This time it was about surface UV radiation. On the left-hand side, you see a screenshot of something called the Data Explorer. And this is how CDC tracking displays and disseminate GIS-ready exposure and population health data sets. And it gives you this side-by-side comparison with a slider in between, so you can do your own assessment, right? You can show on the left the UV radiation exposure, and on the right, susceptible population distribution at the state level. This one was also funded by Applied Science, NASA's Applied Science Division. This is a ROSES 2013 project. In the end, we produced a variety of UV radiation and solar radiation indicators based on OMI data between 2005 and 2015. This one was highly successful. It's still there. It is the only UV data set anywhere you can find with this level of coverage and time duration. And then just to demonstrate the sustained use later on without our help, CDC tracking started to develop this more targeted so-called dashboards. So CDC tracking worked with CDC's Division of Cancer Prevention and Control to develop a melanoma dashboard. I'm showing you just part of the landing page. And front and center, you see their visualization portal. And this map is the annual average daily dose of UV irradiance at the state level. Now, our data actually provided to CDC are at a much finer spatial resolution, but there are some CDC regulations preventing us directly disseminating the highest resolution data. So this was done, the dashboard was done completely by CDC tracking without my help at all. So they have achieved this sustained use. I mean, they got this creative application themselves, which I think is great. So in the latest HACAS project, I proposed to work with CDC again to expand the UV data set for them, actually per the request of the Cancer Prevention Division. So they want us to, and other partners, other partners of the Cancer Prevention Division. So they wanted us to extend the UV data set to cover 1995 to 2020 and include Hawaii and Alaska. For their, they have some very specific applications in mind. So I mean, I think this is great. I'm very happy that we are moving along, and then the value of satellite data, or I mean, at least in this case, this particular satellite data product has been recognized by our partners, and they are willing to chip in their own assets, I mean, their own manpower to sustain the use of this data set. So, if I can put the two sort of examples together, I can identify a few key factors to a successful integration. Number one, you need to have a highly sophisticated agency partner. Usually the science team should be led by PhD level scientists. The reason for this is they are the first crab eaters. They need to do a lot of R&D on their end as well. I think it is common, it's common knowledge now. The build it, they will come mentality will never work. And the idea that NASA produce a data set, put it out there, somebody's going to come up with creative applications and just at no cost, that's also a misunderstanding. That's not how things work. Even though the data is free, they still need to spend their time, spend their computing resources, spend their IT resources to get it into their everyday operation. So that is definitely money. Okay, and second factor is that the satellite data must have the potential to fulfill the agency's need. It's not NASA's need. It has to be part of the agency's core business. And then after that, the scope of work, what kind of a product should be generated for what, that scope of work should be decided at least in collaboration with the agency investigators, and it should be endorsed by the agency management. And then, as you can see, my work and then also the AirNow research were both funded by NASA. So there's a need for a need for funding the initial R&D, and I think this is absolutely crucial. So for both NASA and the partner agency, you both have to chip in. And also the agency has to commit to technical support and sustained use. I know now the applied science projects generally require this, before they even fund a project. And then last but not least, there needs to be longstanding partnership and trust between the research institutions, the partner agency, and NASA. This is very often the time-consuming and kind of make or break component. Now, let me switch gear to the AOS-enabled applications. I took this from the AOS website, and clearly a lot of effort have gone into the thought process, right? Because this is pretty well thought of figure with well-identified potential application areas. I'm going to focus on the health applications. There are 5 of them. So I copy this again from the AOS applications website. And from here, I just want to provide my thought on sort of the potential of this idea and what are some of the possible challenges down the road. So this one, air quality rule and regulation making. I think this is definitely doable. Because satellite data have been accepted by EPA in the state level exceptional event justification report. I mean, this has happened. So it's not we're doing this unprecedented thing. Now the challenge is there are quite a few, unfortunately. Number one, air quality rules and regulations, because they have significant social and economic impacts in a particular region, there are usually proponents and opponents when it comes to rulemaking. So the process of making rules and regulations are also highly regulated, right? So there might be strict guidelines, for example, how CMAQ can be run, how the emissions can be compiled for a state implementation plan, for example. And like the table said, these stakeholders might not have the expertise to kind of factor satellite data or somehow fuse satellite data into their standard procedure. For the satellite data to be useful, they probably first need to be made a eligible source of evidence. The governing body must accept satellite data as a valid source of evidence. I think that can be done definitely in quite a few circumstances. But in other circumstances, this might mean that the applications team, together with the agency technical staff, might have to together present a case to the agency management or even the legislature to demonstrate that satellite data would actually benefit the rulemaking process. We have some interaction with California ARB and then the California EPD about their AB 617 rules. The situation is very complicated, right? So the timing is very important, connections are very important, and then just we need to be kind of mindful in our way of approaching this. Next, air quality forecasting. So my first thought, this sounds really promising because I think at the core of this application, as long as you can demonstrate that satellite data can help, with satellite data's enhancement, the model can outrun or outperform their benchmark. If you can do that, there's definitely a shot to get this into, and even quickly get this into the forecasting business. And now my technical question, without knowing too much about the AOS future products is that from the polar and inclined orbit, actual satellite data may be limited in terms of spatial coverage. So you are trying to inject a small amount of high quality information into an ocean of low quality but high coverage data set. In that case, you have to demonstrate that the value of this data set. And then also another major concern that I learned from over the years is data continuity. Why would they try so hard to get this thing into their day in and day out, only to find out the data wouldn't be in the same format or in the same quality in 3 to 5 years, right? So something to ensure the partners that we're here with you, we're going to work with you to solve that problem is very, very important. And then about health. Now, when I first saw this, my initial reaction was, okay, we had this. We currently have global PM 2.5 mass and speciation data sets, and they are generated by and using existing satellite data. And my personal experience, or kind of my own understanding, is that very often the quality of this data set, this L4 product, depends on the ground truth. Enhanced satellite retrievals only play one part in ensuring high quality PM data sets. So I guess the challenge here is, we have to demonstrate that there is enhancement with pretty limited AOS data from these polar and inclined orbit, right? And also another thing that has been discussed in the NIH circle is that whether or not NASA will generate and host a level 4 curated global PM speciation data set. So NIH is very hesitant in hosting something they don't understand at all. And given the nature of this level 4 product, there's a bunch of stuff that is not NASA going into a so-called NASA product. I've experienced some hesitance from the NASA end to actually host it and call it her own. I mean, I think that's a kind of a larger issue. It's more of an infrastructure issue, but I just want to know that it has been made aware that this could be a hurdle. Okay, and then this one, health insurance and reinsurance. This is very interesting. It's an interesting choice of the stakeholders. I don't know too much about it, but it seems like a good way to engage the private sector. My only thought, and it's not a challenge because I don't know much about it, is that usually when you deal with insurance companies, reinsurance companies, they need to know a specific disease because they charge hospitals, they charge individual policyholders by diagnosis. You have to be able to attach a disease code to a particular expense, right? So there's some R&D to be done to actually link a particular NASA data product to specific disease outcomes, and then the value of information can be estimated. So in this case, I guess having a willing and able partner is very very important. I don't think NASA can just do the heavy lifting on its own. Okay, so in summary, from what I can tell, is that in addition to the AOS team or the remote sensing communities around the AOS mission, there are partner expertise needed to enable these applications. For example, for air quality rule and regulation making, for operational air quality forecasting, the partners, in addition to having a deep understanding of the remote sensing data, they need to have CTM simulation capabilities. And for estimating air pollution, health and ecological forecasting, monitoring, and health insurance and reinsurance, the partners also need some other sort of modeling expertise. For example, air quality exposure assessment, IP model design, ecological model design, and then for the insurance, you need to have someone with actuarial modeling expertise, right? So they can basically assign dollar signs to a particular product, a remote sensing product. And so again, in summary, in my mind, the factors to consider for successful applications include the following. Number one, I think this is the most important, is value proposition. Why is NASA data better than NOAA data? NOAA data is there all the time. It gives you multiple measurements per day, so on and so forth, right? Even though it's not fancy, but okay, it's there. I can depend on it. So you have to, this case must be made before you can proceed. And then the other issue I heard from the user is definitely data continuity. NASA is R&D. I mean, there's absolutely no guarantee that the same data product or data access will remain after the mission is concluded. The Terra Aqua or the US satellites being changed orbits, being, even potentially being decommissioned, it's a prime example. And the users are actually very nervous about investing their manpower, usually a limited manpower and an infrastructure, in something that only lasts 3 to 5 years. Technical support is, it can be built, but you do need, at the beginning, dedicated technical support to sustain the data use and just work out all the kinks. And NASA money would be nice because it's one way of showing NASA's commitment to engage and support the partner agencies and this partnership in general, to build that much needed, to build that necessary trust. And in the long term, I think to make everything easier, I know NASA is nonpartisan, but there should be a general push to promote and encourage policy change to help with the integration of satellite data in agency mandates. This could be a long-term goal for our community, or a long-term, topic for the communities to discuss. Currently, NASA data is not mandated in anything outside NASA. Right? They're good to have, but if I'm stretched thin, I'm not going to engage, and it doesn't really hurt me much, right? So there's that, but I don't know. Probably that's just that's scope. That's beyond the scope of the AOS applications team. So I'm gonna stop there, and thank you for your time.
Well, thank you so much, Dr. Liu. This was an amazing presentation, and yes, I see tons of claps. So yeah, if feel free, everyone, to give a round of applause. Oops, I raised my hand.
Thank you so much.
Yes, thank you again. We have time for some questions. We want to kind of make this, a discussion period. So I encourage everyone to take advantage of the chat to post questions, or the raise hand feature to ask questions to Dr. Liu at this time. So I'm going to just hold out. Oh, we already have one hand. So John, if you want to unmute yourself and ask your question.
Can you hear me?
Yes, I can.
Dr. Liu, a very interesting talk.
Thank you.
Paradoxically, I found things to be upside down. In the past, it had been very difficult to get exposure data, and also difficult to get data relating exposure to disease incidence. It's now becoming much easier to get episodic and sporadic, very fine-grained exposure data, but it remains extremely difficult to find data relating exposure to outcome. Do you have any suggestions for where one might go to find those very important data, or for steps that can be taken to make this kind of essential data available? We can have all the exposure data in the world, but if we cannot tie it to disease, there's very little we can do with it.
Thanks, John. I think that issue is, I mean, you're spot on. The exposure data sets are getting more and more abundant, but the guidance is lacking. And to some extent, this is because the research is still ongoing and this research is still very active. On the other hand, people are a little bit hesitant in taking responsibility, saying, I am going to give you an honest assessment which data set is good for what. I mean, the HACAS team is trying to do that, right? So, of course, you can contact me. You know, we can talk about this offline. For starters, you can probably just try to browse the NASA HACAS website, and there are some README documents about how to use satellite data and link it to various health data sets. And then, you know, last year I was in an NIH symposium, and people talk about this over and over again. Who is responsible for curating exposure data? You know, you have the Human Genome Project, and a lot of the genetic data sets are deposited to a central biobank with a whole lot of metadata. And if you don't do that, you don't get NIH funding. You know, it's that kind of dry. On the exposure side, and then the associated air pollution epidemiology, for example, it's still kind of a wild west. There is no, you know, we don't have kind of a central dispatch, you know, to point people to these available data sets. The support is simply not there. I mean, I think it's unfortunate, and I think what I can do is just to keep talking about it. One positive movement on the NIH side is they want to start with compiling wildfire smoke data into a central depository right now. That project, that's a 3-year project with the NIH support. You know, I'm happy to report back in terms of, you know, lessons learned, how the health people will take the initiative to actually organize the exposure data set and then make them put them into better use.
But again, that's exposure. That's not relationship between exposure and outcome. I'll send you an email.
Yeah. Let's talk about that offline. Yeah.
Thanks, John. All right, well, we do have a couple comments and a question from Amber in the chat. Amber, I'm going to go ahead and read it, but feel free to unmute yourself too. Amber says, absolutely agree. Continuity is an issue and an issue of trust. But for MODIS Terra Aqua, there's a satellite continuity VIIRS, but perhaps not as much for all data product continuity. Some are taking longer, but not fire detections, for instance. Is this what you're saying? And Amber, feel free to unmute if you want to expand on that. And Yang, this is in the chat too for the question.
Oh, let me see.
Can you hear okay, or do you understand
Yep.
the question? It's kind of.
I don't think I read it well. I'm sorry.
Yeah, that's okay. Sorry, it was a long one. I was just saying there is, you had mentioned Terra Aqua. There is data continuity and satellite continuity in VIIRS. And somewhat GOES is also getting better and better. So I think that what you're saying is that some of the data products take longer. Is that what you're saying? Or you just specifically mentioned MODIS Terra, which I think there is, Terra and Aqua. I think there is data continuity for those.
Well, I mean,
so I wasn't sure.
You know, VIIRS know 20 to some degree, but I think devil's in the details, right? You have to take a epidemiology study, for example. They want an exposure data set spanning 20 years, 25 years. What do you ensure there's no systematic bias, there's no temporal drift? You know, the same resolution, so the same model can be run uniformly. It's now left to the researcher to figure that out. And that's kind of the point I want to make.
Yeah, that's a fantastic answer, because so what you're saying possibly is that there should be some investment in understanding what the bias and differences are between products, and that would be a valuable project.
Absolutely.
I think that's what you're saying.
Yeah, I mean,
got it.
Yeah, try the same retrieval algorithm on different, you know, on different satellite products for starters.
Thank you. Oh, and I forgot to say, awesome talk. Love hearing you speak. Thank you,
Amber.
All right. I know one other person just put their hand up. Feel free to unmute yourself. Let me see.
Yes, I just
Alexa.
did.
Yeah, go ahead.
Yeah. Young, it's great to see you like in all good time in person. It's Alexei.
Hey, Alexei. Good to see you.
Yes, it's been a while. Look, yes, at least NASA is maintaining continuity of aerosol products, and our VIRS algorithm fully compatible with MODIS, very well cross-calibrated. We took lots of care on that. Whenever there are trends, they will be removed. That's a very big difference with NOAA, for instance. But I really loved your overview from user's perspective. But I think it's kind of two-edged sword. And one thing which I can mention, for instance, there is very low funding level for our efforts on geostationary. We already have our algorithm on geostationary platforms, and they could be released, I mean, almost tomorrow. But there is certain lack of funding, certain hesitation at the headquarters level. And what is your take? What could be community engagement in this regard, sort of providing feedback to the headquarters that you guys really need that? You know, the quality level difference between NASA and NOAA, at least aerosol products. So what is your take on that?
That's a tough one, Alex.
It is tough, I know, that's why I'm asking.
Yeah, it's I want to say it's about my pay grade. But I mean, I definitely agree. You know, this kind of data continuity project should be high priority if you really care about applications, right? It isn't. NASA is, I agree, NASA is R&D, but NASA also cares about societal benefits. And that's very often very powerful when you can send that message that NASA data isn't just for exploring space. It also benefits people every day, you know, affects their everyday life. But I don't know how to, you know, I think, you know, the applied science division is totally on board with this. I mean, that's why their funding level has doubled in the past decade, right? So I think NASA is taking note. But the issue is, I think this data continuity thing is not really under the applied science division. It's a kind of a different issue, right?
That's exactly my point.
Right.
We are in a remote sensing part of the NASA, and
Yeah.
it's sort of getting ignored in a way. And the longer we wait, the worse the situation will be.
Yeah, I feel you, brother, but I don't know what to say to that. I certainly wish I can help.
Yes, I understand.
Yeah.
Thank you. Yeah.
Sure.
All right. We're almost out of time. I see that John, Amber, your hands are up. Did you have another question?
No, I did not.
I do, and that it won't be a quickie, but the best you can do. And that is talking about, I saw you had speciation in your talk, and thinking about the vertical resolution and what we're going to get from AOS and speciation. Have you had any pushback in the community? Because I know Calypso, the backscatter LiDAR, has struggled getting speciation. I mean, they do it, but it's a guesstimate because it doesn't measure the LiDAR ratio directly. So I guess I'm asking about pushback and how you talk with the user community and any issue around it. If you wanted to get that.
Yeah, thanks, Amber, for that question. Well, first of all, the aerosol speciation information is kind of the bleeding edge of air pollution health effects research right now. Everybody wants that data set, but it's extremely difficult to estimate. And I think one sort of coming out of the AOS ACCP study, I was a little disappointed that we didn't have time to fully explore how air quality models should be integrated. It should be a key part of the mission. Because the way I see this is, for example, LiDAR data, Calypso type of backscatter LiDAR or HSRL type of more powerful LiDAR data could truly benefit an advance of understanding of the CTM. And CTM, it gives you the full coverage, it gives you all the species, but it's suffering from this garbage in, garbage out problem, right? You need to have great input for the CTM to generate great output. I mean, it's unfortunate, I have to say, but I mean, I know people, if you ask an epidemiologist, what do you, if you can choose, you choose backscatter LiDAR or HSRL, you get a blank face. He doesn't know what that even means. But if you talk to air quality modeler, they would say, the more information, the better. And that information eventually will benefit downstream applications for sure. And yeah, I see Ralph's comment. Yeah, we've been, MAIA is almost like the only game in town now when it comes to modeling ground level PM speciation. So very often we couple MAIA data with MAIA data with CTM simulations to generate speciation estimates. But you know full well, MAIA alone is not enough. And then, again, MAIA doesn't give you a whole lot of vertical information, some vertical information, but not a whole lot.
All right. Since we're basically at the top of the hour, I do want to be respectful to those that have probably meetings right at the following hour. There is a comment, if you do, Dr. Liu, want to answer about what about the upcoming tempo data, if you want to do any quick comments about that.
I think that's wonderful. Especially, I'm going to jump into the early adopter program. I actually hosted the early adopter workshop. That's great. Everybody should take a look at that.
Perfect. That's a great way to wrap it up. I just want to say thank you again, Yang, for being on this call. It was a wonderful talk. Thank you all for the discussion, and everyone have a fantastic rest of your day. Much appreciated. Thanks a lot, Andrea. I'm glad to be part of this community. Thank you. Yeah, we'll stay in touch. Thanks. Bye.